Okay, we're in our last chapter for Module 4, Providing Employee Benefits. Employee benefits are compensation to employees in other forms than cash. It helps attract, retrain, and motivate employees. I know a number of people who will go and ask about the medical that a company provides and decide whose job offer they're going to accept based on the benefits and not so much on salary. It can help employers tailor their compensation to the kinds of things that employees need. Employees have come to expect the benefits will help them maintain economic security. Benefits impose significant costs. And here's an example of the percentage of compensation. Back in 1955, benefits were 14%. Now they are 31.2%, so it's a big difference. Certain benefits are required by law. Tax laws can make benefits favorable to employees. Employers can get volume discounts on insurance. So it's much cheaper to buy for all my employees than it would be for my employees to buy it themselves. Competitive benefit packages can make companies competitive. So what benefits are required by law? Social Security. It's a flat payroll tax on employees and employers. Unemployment insurance, payroll tax on employers that depend on the state requirements, and an experience rating. An experience rating means how many cases I've had. If I've never had anybody on unemployment, my experience rating is much lower than someone who has maybe a seasonal business and lays off all their employees every fall. Workers' compensation insurance provides coverage according to the state's requirements. Premiums depend on the experience rating again. The Family Medical Leave Act, up to 12 weeks of unpaid leave for childbirth, adoption, or serious illness. In health care, for employers with at least 50 employees, a payment of a fee to the federal government if the employer does not meet the conditions for providing health care benefits. So Social Security has employers and employees share the cost through payroll tax to provide the benefits. It's comprised of old age or retirement insurance. I don't like that, old age. Retirement sounds much better. Survivor's insurance. If I passed away and my husband was, he might be eligible for survivor insurance. Disability insurance. If I become disabled and can't work at any time, I can get Social Security based on that. Hospital insurance, Medicare Part A, or supplementary medical insurance, Medical Part B. Unemployment is a federally mandated program administered by the states. It minimizes unemployment hardship. Most funding comes from taxes on employers. The size of the unemployment tax imposed on the employer depends on the employer's experience rating, which we just talked about. HR planning can help the experience rating keep it down. To receive benefits for unemployment, workers must meet 4 conditions. They can demonstrate they were employed, they were available for work, they were actively seeking work, so you just can't say, well, I'm on unemployment, I'm taking some time off. No, you have to be looking for a job, and you were not discharged for cause, did not quit voluntarily, or were not out of work because of a labor dispute. Workers' compensation are to help employees that have suffered work-related injuries or illness, or to their survivors. They operate under the principle of no-fault liability. The employee does not need to show that the employer was grossly negligent in order to receive compensation. The employer is protected from lawsuits. They earn about 2/3 of the wages and are tax-free. There are 4 categories of benefits: disability income, Medicare, death benefits, and rehabilitative benefits. And the cost varies. The Family and Medical Leave Act. Organizations with 50 or more employees must provide up to 12 weeks of unpaid leave after childbirth or adoption to care for a terminally seriously ill family member for the employee's own serious illness. Same comparable job guaranteed upon return. Must comply with the Pregnancy Discrimination Act. I took medical leave when I had my children, so I got paid disability for 6 weeks after they were born, and then I took an additional 6 weeks unpaid at the time. Patient Protection and Affordable Care Act. Employers are not required by law to provide health care. That goes back and forth depending on who's president. Those who choose not must pay a penalty. The choice depends on the number of full-time employees. So small businesses can buy insurance from a shop, or you can go through the business associations. Usually they offer this to small businesses so that they can go together and negotiate a cheaper rate. So the law is complex and changing. HR need to keep up with it, basically. So here's the type of benefit and the percent of access to selected benefit programs. So which optional benefit program is most important to you? Paid leave, medical insurance, life insurance, disability insurance, retirement plans, family-friendly benefits, or things like tuition reimbursement or employee benefits. So paid leave, the major categories are vacation, holidays, sick leave. They also count for things like jury or military duty. The average paid leave in the U.S., 23 days, vacation days, and 10 paid holidays. I never got 10 paid holidays. I think that's pretty rare, actually. Sick leave days that accumulate with the terms of service, personal days, floating holidays, or paid time off are other options. Medical insurance, 70% of all full-time employees receive medical benefits. They typically cover hospitalization, surgical expenses, and visits to physicians. Additional coverage may be dental or vision care, mental health care, birthing centers, or prescription drug programs. COBRA is if you leave the job, you have to allow the employee to continue their health benefits. They pay for it, but they can get it up to 36 months after layoffs, reduction in hours, or employee's death. It's just so you don't kick people off and they have nothing to go with. They have to have an option for a time period. Employers' approaches to controlling health costs, they have managed care, HMOs, PPOs, ACOs, CDHPs, EWAs. You can read through the book to see what the differences are. Life insurance, employers may provide life insurance or offer the opportunity to buy coverage at a low group rate. Term life insurance, if the employee dies during the term of the policy, beneficiaries get the death benefit. Wellness programs. Many companies offer wellness programs such as yoga classes to encourage employees to reduce their health risks as insurance costs climb. Disability insurance, short-term disability insurance is a percentage of the employee's salary paid for 6 months or less. Long-term disability is 6 months or more. It's a percentage of the employee's salary paid after benefits after initial period and potentially could go for the rest of the employee's life. Not all employers. In New York State, you have to provide short-term disability, but you do not have to provide long-term. Resources for people over 65 or older, Social Security, pensions, and annuities, earnings, still 30%, investments, and other. Retirement plans, contributory plan is funded by the employer and the employee, like a 401k. It could be a non-contributory plan, which is funded entirely by the employer. The desired defined benefit plan guarantees a specific amount of retirement income. It has to meet the requirements of the Employee Retirement Income Security Act, which is ERISA, aided by the Pension Benefit Guaranty Corporation. Some optional benefits, retirement plans, defined contribution. The employer sets up an account for each employee, specifies the size of contribution in the account, money purchase plan, profit sharing, employee stock options, 401k. We have 403bs here because we're education. Cash balance plan, employers set up an account for each employee and they contribute a certain part of the employee's salary. So here's the value of retirement savings invested at different ages. If you do in your 20s, we save $3,000 annually, you'll have $500,000 at a certain point, compared to $250,000 for 30-year-olds. Okay, so group requirements for vesting and communication. So I start work at a company, I have a 401k, and they pay a percentage, like I can put a 6% and they'll match that 6%. Do I get that money right away? No, you have to work for the company for a certain number of years generally, and that's called vesting. A common vesting period is 5 years. After 5 years, I'm fully vested. All the money is mine when I leave the company. Summary plan description, report that describes pension plans, funding, eligibility requirements, risks, and other details. So Jakar does not know a lot about investing and wants to ensure he has some retirement income when he retires. Agnes plans on changing employers every few years and is investing her own money. Which plan will be best for Jakar and Agnes, respectively? Defined benefit and defined contribution, defined contribution, defined benefit, contributory and defined benefit, defined contribution, and non-contributory. What do you think? Well, I think the answer is A. A defined benefit plan guarantees a specified level of retirement income. Usually the amount of this is defined benefit is calculated by each employee based on the years of service, their age, and their earnings level. A defined contribution plan sets up the individual account for each employee, specifies the size of the investment that into that account, and rather the amount that will be paid out upon retirement. Okay, so optional benefit plans, family leave, family-friendly things. Benefits are family leave, child care, college savings, or elder care. Other benefit programs, subsidized cafeterias. I don't pay the full price to eat in the cafeteria, basically. That doesn't happen here. We pay full price. On-site health care visits, fitness centers, which we have advantages of fitness center here as employees. Dry cleaning, moving and relocation, employee discounts. My kids work for Disney and they get a lot of employee discounts. Tuition reimbursement, they also get tuition reimbursement. Dues for professional organizations, so if I join an organization, the college pays so much towards my dues every year. Off-site recreation. We used to have an outing every year to the zoo at the company I used to work for. It's kind of cool. The organization's objectives. Decision about benefits should take into account the organization's goal, objectives, benefits, the expectation of current employees, and prospective results. An organization that does not offer expected benefits will have difficulty attracting and keeping employees. Employees' expectation and value. The employees expect to receive benefits that are legally required and widely available. They value benefits that are likely to use, and their values may differ from one person to the next. Cafeteria style plan is very cool. Employees can choose the type of benefits and amounts of benefits they want from a set of alternatives. So what happens is the company gives me $50 to buy whatever I want with, and then it shows me the per paycheck charge for long-term disability. It's 60% of my rate, 70% of my rate, life insurance plans, and more. They give me so much money to spend that, so I can gear the plan towards what I want or what I need. And my wants and needs may not be the same as other employees. So that's the beauty of a cafeteria plan. Okay, some approaches to saving money. Switch from traditional health to PPOs and CDHPs. Shift more of the cost to employees. Extend or limit coverage for different types of claims. Learn which providers and treatments deliver the best value. Tax treatment of benefits. Qualified plans are more favorable tax. For example, I don't have to pay tax on the money that I pay towards my health care premiums or towards my retirement. Anti-discrimination laws. So intended to give equal employment opportunity without regard to race, sex, age, disability, and several other protected categories, such as the Pregnancy Discriminatory Act, the Age Discrimination Act, Older Workers Benefit Protection Act of 1990, and American with Disabilities. So I have to make sure I'm hitting all those requirements. Accounting requirements. the Financial Accounting Standards Board sets requirements for each company's financial statements. It ensures the statements are a true picture of the financial status. Employers must set aside funds they expect to need for benefits to be paid after retirement. A statement must list the funds as retirement's future cost contributions. And finally, communication is essential. Employees must be given information about their benefits. And there's a legal requirement to do that. If there's problems with the funding in your 401k, they have to notify you that there is a problem. Necessary to attract, motivate, and retain talent. It's difficult for employees and applicants to understand the value of benefits, so the companies must help. And the employers can use a variety of media to communicate. So that's it for Chapter 14. That's the end of Module 4. You have your Module 4 test that is due, as well as your discussion case study number 4. But this is the last one of those, so make sure you get them done.